Today, I'm going to talk about a topic that I've been asked about by many, many people. Can iridology detect cancer? I will give you the absolute honest answer. Iridology cannot detect cancer, but what it can do is give you an indication that there could be a problem with cancer inside the body. I do remember a case where I photographed this lady's eyes. It was in Singapore. I worked there. And I said to her, "You're a smoker." And she said, "How do you know that?" I said, "Because you've got this marking in your eye, which indicates a possible cancer inside your colon, right?" And she was like, "What?" I said, "Yes." So I took the photographs, and there it is. There's the actual photograph. Now you can see there's something outstanding already. You can see this is a like orangey type color, right, which is like hazel. But then all of a sudden you see this. See this mark in there? You see the dark, how dark that is? Now, when you see darkness in hazel, very dark light in one spot, that happens to be the colon, the transverse colon, okay? Now, when you see that, you've got to warn the patient that you better get that checked out. Now, remarkably, when the patient was checked out, properly checked out, that cancer was about 3 months old in the colon. Now, what's remarkable, I've seen this happen. Cancer can take up to 14 years to manifest. Let me be very clear here. You can have cancer inside you, you don't even know it's there. And it just keeps working on you and building and building and building and invading your cells. And eventually, 10 years, 12, 14 years later, you wake up feeling really sick and you got graves on. And then you go to a doctor or you go to an oncologist and he says, "Sorry to tell you, after testing, you got cancer." But by then, the cancer could have really invaded every part of your body or many parts of your body, and it's then very, very hard to work through. And of course, you'll get taught to use radiotherapy, chemotherapy, all kinds of very heavy chemical type reactions, radioactive with drugs built into it, and so on and so on. It's much better if you get a iridology, in my experience, to photograph your eyes and pick up if there's anything unusually dark or stain in your eyes. And then I can tell you where I see it, whether it's in the colon or your pancreas or your liver and so on. And then you can go and get tested, right? And then that could save your life. Because in some cases, I've detected there was a problem 3 months after the lung cancer started in this particular patient. 3 months. So that was able to then be treated and revert the cancer to zero. You see? That's how exciting that is, right? Now, I've trained doctors in Singapore and Malaysia, and the professor of medicine who was working with me told the 30-year student, 30-year student, "If you don't listen to Ronald, you'll never be a good doctor. You've got to learn this science." And I was really pleased to train between 300 and 400 doctors in a sitting, right? And those doctors now are very aware of the iridology and what it can do for their patients. And that's exciting. Now, since you've been shown interest in what we do, I'm going to recommend right now that you subscribe to our channel right now. Don't waste the opportunity to get to know us. Subscribe to our channel. And in addition to that, whilst you're subscribing, after you subscribe, there's a book, an ebook which I've written during lockdown. It took 3 months, and it took a lot of work. Every single day, 6 to 8 hours of writing. This is an ebook, and the book is about what your eyes can reveal about your health. You will love what's inside there. It's only a small booklet, but it's very potent. Every advice in there is essential. Get to know this book, and then give us a call and make a booking to talk to us for about 20 minutes on a Zoom call. And again, I say, subscribe now and get excited about your health.